Many colleagues at BD have done this in a similar manner. So we entered into the partnership in June 2010 with leadership from your Ministry of Public Health and Sanitation and the CDC Kenya and PEPFAR to launch the Safer Blood Collection Initiative, which is a multi-year program to improve blood collection practices. And Kenya was the very first country to engage in this program. We provide very comprehensive training on safe blood drawing practices and specimen handling to Kenyan health workers. And this is both to ensure the accuracy of test results and to minimize the risk of patient to caregiver transmission. In the first year, we conducted training in 8 facilities that reached 60% of the Kenyan population. BD, the CDC, and NASCOP trained more than 500 health workers and 20 faculty members. The training was implemented at a number of different hospitals, and I have them here, but I'll mispronounce each of them, so I'm going to dispense of doing that. But both the hospitals and also at 4 satellite facilities in the districts. The program was then expanded to reach over 2,000 health workers in over 30 facilities throughout the country. We're monitoring the results. One of the things that CDC is so effective with is results monitoring, and we've seen that post-test scores of trainers, including master's trainers, have increased by more than 40 points over baseline test scores. So we know that the training is working. And when this was extended to a much wider group, similar results were achieved with 495 health workers at 8 pilot sites trained by the new master trainers. So based on this progress, which was very rapid, the Global Business Coalition, which is also represented here today, awarded BD, the Kenyan Ministry of Health, the CDC, and PEPFAR with their GBC Health Award for the Kenyan Safer Blood Drawing Initiative, which was a very positive indication of our success. So today we're here to announce a new commitment to establish the first Center of Excellence in Phlebotomy and Specimen Collection in collaboration with the Kenyan Medical Training College, Department of Medical Laboratory Sciences, in close cooperation with the Ministry of Medical Services, CDC, JPEGO, and PEPFAR. This will be the first of its kind in East Africa. This Center of Excellence will help to strengthen Kenya's capacity for diagnosis, management, and monitoring of HIV and other diseases. It will improve the quality and safety of specimen collection by building the skills and capacity of Kenyan health workers in a sustainable manner, providing both pre-service and in-service training. We will be donating up to $125,000 in training materials, equipment, and renovation of the KMTC facility, and will provide training in technologies and hands-on skill stations and support curriculum development, content, and capacity building at the facility. We'll also provide training on occupational safety and key clinical and laboratory procedures to help improve safety for health workers and patients. Working with our partners, we hope to institutionalize this particular program as a model for other countries throughout sub-Saharan Africa. So today's commitment to establish the Center of Excellence at KMTC builds on our many years of commitment to Kenya that goes way back. We've been supporting the Nyumbani Home not far from here, starting with a donation of a CD4 analyzer for their small laboratory back in 1996. Most recently, we worked on helping accredit their new laboratory, which is one of the most sophisticated in sub-Saharan Africa. It's doing genetic testing on children for resistance to first and second line therapies. That's happening nearby, and they're doing amazing work. We also conducted 167 good laboratory practice training sessions here to help strengthen capacity immune system monitoring. And we also established a Center of Excellence at KEMRI for CD4 applications and other lab procedures.